Hi and welcome from me, David H. Now, this is about what causes tinnitus and can it be cured? Okay, hi there. Now, tinnitus is a symptom that can be linked to a huge number of different illnesses and medical conditions. Um, in this video, I'm going to go over the main causes of tinnitus and why tinnitus actually happens, as well as looking at the cure for tinnitus and examining the question, can it be really cured at all? I'll also look at the management of your tinnitus, looking at the tried and tested tools and treatments that can help you manage your tinnitus, and in doing so improve your quality of life. Now, because let's face it, anyone who suffers with tinnitus will tell you at times it can be horrendous. So let's get on with it. But before I do, if you can subscribe, like, do the notification bell, that would be great. I'm always told I should ask, but always forget. So today I've remembered. So do it now, please. Thanks. Okay, now at the end of the video, there will be my number one cure that works for tinnitus sufferers. So keep watching to see that if you want to end your tinnitus. So finally, on with the vid. Tinnitus is a symptom of another underlying health condition. It's not a disease in itself. Tinnitus is a sensorineural response in the brain caused by damage to the ear and auditory system. That's in the majority of cases. Now, while tinnitus is frequently associated with hearing loss, it can be a symptom of over 200 different health or medical conditions. I've looked at some of the most commonly reported tinnitus catalysts here. Now, bear in mind that tinnitus does not always mean one of these symptoms can be the cause. Patients with tinnitus should see their own doctor or a hearing health professional for a thorough examination to determine the cause of their symptoms. In some cases, resolving the root cause will actually reduce your tinnitus perception altogether. So, hearing impairments or hearing loss is the number one reason of what causes tinnitus or tinnitus. Tinnitus is frequently associated with sensorineural hearing loss. According to some researchers, subjective tinnitus cannot exist without some form of auditory system damage. Now, the underlying hearing loss could be caused by presbyculosis, or in plain English, age-related hearing loss. Hearing generally deteriorates as people get older, usually start around the age of 60, but of course it can be younger. The sensory loss of high frequency sounds is common in this type of hearing loss. It's usually bilateral, so in other words, it affects both ears, the hearing loss. Now, tinnitus is more common among the seniors or the older people because of this, and it is an age-related hearing loss that is here. So now, hearing loss caused by noise is different. Loud noise can damage the auditory system, resulting in hearing loss and sometimes tinnitus. Now, whether in one-off loud noise experience or over a period of time, traumatic noise exposure can occur in many places. For example, it may be at work working with loud machinery, when you're out enjoying yourself, having fun. For example, loud sporting events, crowd noises, loud music concerts, or any sort of recreational activity that creates a loud noise, or by accidental noise from a car backfiring, or one-off noise from those idiots that put those stupid exhausts on to make a noise on the car, to make it sound as though it's backfiring. Why do you do that? Anyway, noise-induced hearing loss can be unilateral, so it can only affect one ear or both ears, and patients typically lose hearing around the frequency of the triggering sound trauma. Now, it's important to remember that existing hearing loss isn't always obvious to the patient. You may not notice the lost frequencies at all. However, this does not rule out the possibility of hearing loss. Sensitive audiometric tests can be performed by a trained audiologist or other hearing health professional, which can then accurately measure the true extent of hearing loss if you have any. Now, researchers are still looking into the exact biological process by which hearing loss is linked to tinnitus. We do know, however, that the absence of certain sound frequencies causes specific changes in the way the brain processes sound. In other words, as the brain receives fewer external stimuli around a certain frequency, it adapts and changes. Tinnitus may be the brain's attempt to compensate for the absence of sound frequencies from the auditory system. Now, this is why it's so important to have your hearing checked, especially as you get older. Another reason to look at what causes tinnitus is middle ear obstructions. See, blockages in the ear canal can cause pressure to build up in the inner ear, impairing the eardrum's ability to function. Furthermore, objects that come into direct contact with the eardrum can irritate the organ and cause tinnitus symptoms. Now, typical roadblocks here can include sort of earwax buildup, a congested head with cold or allergy reactions, ear canal hair that is loose. We also grow more ear hair as we age, another advantage of getting old. Anyway, foreign objects or dirt in the ear, just be careful what you put near or in your ear. On this, a big warning as well: do not use these cotton buds. They cause so much damage, they actually just push the wax further down, compacting in your ear. With blockages though, this is the thing with tinnitus, the symptoms can often be relieved or even removed totally once you take the blockage away. In some cases, however, the blockage may have caused permanent damage, so resulting in chronic tinnitus. Chronic being it's there for good and it's not going away. So always check if there's a problem with your ear, have it checked out straight away, don't just leave it. Now, another cause of tinnitus is a trauma to the head or neck or both. This can cause the worst effects of tinnitus. You see, a severe head or neck injury can result in nerve damage, changes in blood flow, and muscle problems, which can cause tinnitus. Tinnitus, its volume and perceived burden are often higher in these patients who attribute their condition to the head and neck trauma they've experienced. Also, it tends to have a greater variability in sounds, the frequency that you hear and the location of their tinnitus. This cause of tinnitus is referred to as somatic tinnitus, caused by problems with the head, neck or teeth. When looking at what causes tinnitus, then temporomandibular, or much easier to say TMD, the joint disorder. Tinnitus caused by TMD is another example of somatic tinnitus. The TMJ, the joint that is located in the front of the ears and connects the lower jaw to the skull here. Now, tinnitus symptoms can be caused by damage to the TMJs, the muscles, the ligaments, or cartilage in this area. The TMJ is close to the auditory system and it shares ligaments and nerve connections with middle ear structures. So patients with tinnitus who have TMJ disorder will have pain in the face or end or jaw, sometimes limited jaw movement or regular popping sounds while chewing or talking. TMJ problems can be diagnosed and treated by a dentist or a maxillofacial, craniofacial surgeon or other oral health professional. And tinnitus symptoms are often relieved by correcting the TMJ disorder itself, but long-term damage may have already been caused. So again, have it checked out straight away. Now, another cause of tinnitus is barometric trauma and sinus pressure. A severe cold, flu or sinus infection can cause abnormal pressure in the middle ear, which can impair your normal hearing and cause tinnitus symptoms. Now, the middle and inner ear can be damaged by acute barotrauma, which is caused by extreme or rapid changes in air or water pressure. So, some of the potential sources of barotrauma are if you happen to go scuba diving, snorkeling, or diving itself, flying as well, but usually only the extreme type, doing the circles and the rapid drops from the sky, usually air shows, that type of thing. Normal commercial air travel, though it's generally okay most of the time, unless there was a really extreme situation on a plane, that wouldn't affect or normally cause it. So, be near explosive blasts that you would get concussion with. You see, tinnitus is you can get through a traumatic brain injury. It's a type of traumatic brain injury where you have concussion. An induced traumatic brain injury can damage the brain's auditory processing areas, resulting in tinnitus symptoms. Now, tinnitus is commonly caused by TBI. A lot suffer this who have been in the military. Now, veteran soldiers, many have this. So, you know, they have it on a mild to severe traumatic brain injuries account for nearly 60% of all tinnitus cases diagnosed by the US Veterans Administration. It's a hell of a lot, isn't it? Now, when it comes to causes of tinnitus, this is a bit of a double-edged sword. Ototoxic drugs. Now, many prescription medications can cause tinnitus as a side effect. Now, tinnitus is acute, short-term side effect in most cases and for most drugs. If the patient stops taking the medication, or when they stop taking the tinnitus symptoms usually go away. However, some ototoxic drugs have been linked to long-term tinnitus symptoms. Some of the drugs are anti-inflammatory drugs, such as the ibuprofen type, antibiotics in particular, certain cancer treatments, diuretics and water tablets, quinine-based pharmaceuticals. Now, you should always consult your doctor, your physician or pharmacist if you're concerned about tinnitus as a side effect of your medication. You should never stop taking any medication without first consulting your doctor, because stopping a medication could have far more risk than benefits. Now, some other medical conditions and diseases that can cause tinnitus. The following medical conditions have all been linked to tinnitus: hypothyroidism, hyperthyroidism, and anemia. They're metabolic disorders and have been linked to tinnitus. Lyme disease, fibromyalgia, and autoimmune disorders, high blood pressure and atherosclerosis, two blood vessel disorders, depression, anxiety and stress are psychiatric disorders that can cause tinnitus, and Meniere's disease, thoracic outlet syndrome, otosclerosis, examples of vestibular disorders, acoustic neuroma, vestibular schwannoma, and other tumorous growths are tumour-related disorders that are extremely rare though. Tinnitus sufferers should not assume they have one of the medical conditions I've mentioned in this video. The underlying cause of tinnitus can only be properly diagnosed by a trained healthcare provider. In saying this, if you have a ringing, buzzing, whooshing or noise in one or both of your ears, it's likely you will have tinnitus. So, to summarise and conclude, as well as my way of stopping my tinnitus, or tinnitus, that I had for over 15 years. So first of all, let's have a look. We've gone over, there's lots of reasons we can develop tinnitus. There are over 200 plus medical health reasons. We should not presume that we have one of these though. Your healthcare provider should be the one to diagnose anything. And the cause, depending which cause, can mean that your tinnitus is permanent, but it can be managed. There's lots of things. I've done a video on various other options on treatments and cures that you can use. Have a look in the videos there that I've done. I think there's a link above or in the description. You know, it can be a temporary problem, or it can be a permanent problem, tinnitus. If it's temporary, that will go away on its own, and there's no need for any treatment really. But when is that the case? If it's maybe through a cold or something like this, then that's fair enough. But anything else, just have it checked out first. Now, it's not a life-threatening condition as such, but I was staggered. I know I did a video before on tinnitus, and when I looked at the percentage that suffer tinnitus who have taken their own lives through the sheer magnitude and effect tinnitus has had on them. So, tinnitus cannot be trivialised. It's a serious condition that needs attention and treatment. And don't leave it to get worse and worse, because it will get worse and worse. My own, I had it for, say, over 15 years, and it increased the intensity, and the noises were horrendous at times. It really were. My own cure, and I will call it a cure because I no longer have it. It was from the #1 supplement from the top 7 tinnitus remedies site that I looked at. Well, it's on there now, but I'm not saying that this will be the answer for you. One of them on there may well be, so have a look, because this is the other thing. We're all very different with our health and how we treat things, and I've only looked, mine was more of a natural cure because I don't like the pharmaceutical drugs, but it's a natural cure for, and I've put the link to the site for the top 7 tinnitus supplements in the description. Now, I'm hoping it will help somebody. If you have got something from this video, please subscribe and like and press the bell notification, because I'm always doing more videos weekly, usually weekly, once, twice a week. And I always tend to try and look at the natural therapy side of things. I'm not saying that conventional medicine isn't important, of course it is, and I wouldn't rule it out. But I like to always try and look at natural solutions. As a practitioner of hypnotherapy for over 20 years, and natural therapist, this is my preferred method. So on that, I will like to thank you for watching and staying to the end. I'd like to wish you all good health. Take care. Bye bye for now. From me, David H, and see you in the next video. See ya.